I'll call the meeting to order. We'll do roll call.
Okay. Ready? George Busse.
Here.
Clarence Campbell,
Here.
Richard Huber,
Here.
Matt McKenzie. Matt McKenzie. Laura Negro. Laura Negro. Dr. Keller,
Here.
Dr. Horning,
Here.
Laura Cruz. I know she's here. Laura Cruz. Joy Henriksen. Here. That's it.
Next item is the approval of the meeting minutes from the last meeting.
Motion to approve.
Motion made and seconded to approve the minutes of the last meeting. Any additions or corrections? Did anyone notice? Otherwise, all in favor, signify by saying aye.
Aye.
Opposed? Motion carries. Public comments. Anyone in the public wishing to make comments? Anyone online? Seeing none, we'll move on to (2023) year-to-date expenditures.
Hi there. I see Tasha's trying to pull it up. Okay. So, not a whole lot to report here, just kind of looking, overall, we're sitting at 70% of our expenses, which is kind of where we want to be at. This is 75% of the year. So that's looking good overall. Same thing for where we're at for that levy amount. We, some of these, we're kind of at that point now where we're going to be less grants, more levy. So it's going to keep tipping the other way for the last 3 months of the year. This one thing that I was just going to mention was public health is, you could see, is over. They're on the next page there. Yep. No concerns here. There was grants that weren't budgeted for because we didn't know we would have them. So she's going to have an increase in revenue and expenses and be over on both sides. And in September, August, she'll be talking about here in a little bit with her updates. She purchased playgrounds, which we have not received the grant money back for. So the expense is there, but not the revenue. So I don't have any major concerns, but just kind of wanted to point that out. And before I move on with that, does anybody have any questions on anything on here? So then this will lead in, if you want to go, can you go back to that, Tasha? Or wait, yeah, the next B. Okay, it's not on here. So what we're going to lead into then, Terry's going to talk about the cost of children in sub-care and also adult in sub-care a little bit, which that would go up. It's not reflecting on this report because the expenses weren't paid in September. They're paid in October, so we'll notice it more on the next report. But for a, yeah, that'll be, and then we'll talk about that sub-care with Terry.
Me.
It's there.
It's working on it. So when it does come up, this will be something that you usually get in your packet. We got it late, so we're just going to show it to you now. The good news is, if you look at the first top here where it says cost of children in sub-care, you can see from June on, we've been significantly less than we were last year, which will end up with a good ending at the end of the year. If we keep this up, we just have 2 more months to go. So that is the good news. The unfortunate news that I have to share is Tasha's out of home care for the adult unit. Those costs have gone up dramatically in the last 2 months. And so the savings that you're seeing here are going to be realized on the adult side because we have several people in very high cost placements right now. One of whom has been there for going on 2 months. A younger gentleman with significant mental health issues and homicidal ideations. And he actually did hurt people at the last placement he was at, so you can understand people would be hesitant to take him in until he's very stable. So that gentleman, his costs are almost $45,000 a month. And we have another person who has some significant psychosis as well, running the same amount, and then 2 shorter stays. So the most recent bill that we have from Winnebago for 1 month is $118,000
For
Um,
1 month.
for 1 month. The daily rate at Winnebago is $1,451 a day.
Oh,
So it doesn't take long, and we've had 2 people in there for the whole month. So usually the stays are between 1 to 5 days. You know, sometimes they've been inappropriately detained and they get better immediately and we can get them back home. Sometimes it's just medication that they need or some environmental changes, things like that. But these 2 folks who are in there, they have some really significant issues that they need to try to handle medically and with some medications before they can be released. So that is the priority of the adult unit right now. But I wanted to make you aware of that because that isn't reflected in the budget that you've just seen. Those are new costs coming in. Tasha, did you want to add anything to that?
I think just going along with what Terry said, we've had some longer placements and like she was explaining, definitely due to much more significant, including homicidal statements that, and then acting on some of those statements. So we are seeing more complex situations with the adults who are placed on emergency detention sometimes, which then of course is increasing the cost very quickly.
Dr. Horning?
Do you think we should start having like a 3rd box with adult costs? Because we've been getting the kid ones for this chart for as long as I think I've been on the board, and it's really helpful. And I think as we're explaining, if we're over budget, really helpful to see, gee, look at 2021, 2022, look what happened in 2023.
Yep.
There's no way to budget for that, you know what I mean? So I guess I would find that helpful if this is not like a one-off kind of one-time deal.
And we did have that, the fiscal unit was doing that before, and I have asked them to put it back together. They just haven't had time to do that, but we'll work on that.
Cool.
I think that is very helpful. And then we can see trends and patterns and.
Yeah, I just have a dumb question on the overall summary sheet. The total. The budget number, is that year-to-date budget or full year budget? I just don't know what it means.
On the very top here, it's
Yeah.
year to date.
Yeah, well,
Just
on
budget
the
column.
budget column itself, that is the whole budget. Like that's the amount we budgeted. The actual column, that is year-to-date cost.
Okay, so the budget number is not the 9 months budget, it's the 12-month budget.
Yes.
Thank
Exactly.
you.
Yep.
Okay.
Any other questions? All right, we'll move on to number 5, Spark Ignite Program Update.
I don't know
Is that-
it's Scott on.
Is that on?
Yep.
Yeah, it's down there. Are you there?
Hello?
Scott?
There he is. Can you hear me all right?
I can hear you.
All right, there we go. There we go. Hello, everyone.
Hello.
Hi.
Hi, so I just give you a brief update. We have programming going on right now. Have a couple people call in sick and a couple people on vacation this week, so a little shorthanded here, but we are running 4 to 5 nights a week with Spark as we were last school year. our average nights right now are right around 40, right around 40 to 45 kids a night on average. Our biggest night this year was about 70 kids, which is too many. That was a moment where we realized that we really needed to try and put some guardrails up so that we don't end up with 70 kids in one night. It makes transportation really difficult, etc. So, but we are kind of running at full capacity right now during the Spark program. So things are going quite well. A lot of new sixth graders, which is great. And this year we're doing a really nice job of retaining a lot of our high school kids. So we have a really nice broad age range, and we've developed a new peer mentorship program so that our high school kids are really providing some good peer mentorship for our younger students. Our high school kids, primarily youth from our new Ignite program, which is running during the school days in partnership with the school district. Youth from the school district, from the Ignite program, actually developed and ran our sixth grade orientation program this year. So, so we're really working hard at having our older kids really step into that mentor, that peer mentor role with our younger students, which is working nicely. So, the Ignite program, which we launched at the beginning of the school year, we just hit our 2-month mark last Monday. So we've had 25 kids that were identified through using a number of different data points at the school district. Again, this is a school district grant that they partnered with us on. So they are contracting with us to provide a project-based alt-ed program here for half days, Monday through Friday during the school year. So we are working with our kids on project-based learning, taking them out of that classroom setting. For the kids to have been included in the program, they all were at the kind of this Venn diagram of either getting suspended or having multiple disciplinary referrals, having relatively poor attendance. Most of our kids last year were attending in that 25 to less than 50% of the time, failing classes and falling into the low socioeconomic status. This year, our attendance thus far has been, the last time I averaged it out, which was a couple weeks ago now, but we were right around 90% attendance, which from the district standpoint is phenomenal. We also have seen the attendance improve at the school district for hours 1 through 4. So we're feeling like we're on a good trajectory. Always room to grow. It's a brand new program. We have a lot of, we feel like we're learning and working things out every day. We're trying to figure out how do we continue to help these students improve and improve in their academic performance and improve in their engagement and just being more engaged and working towards having a positive future. So thus far, I think the results are positive and still always looking for ways to improve. Any questions?
Thank you, Scott.
All right. Thanks, everyone.
So,
You guys, I'm on a meeting right now.
one question.
Yes.
So the EAT program, do they have to be in school? Is it they're in school in the morning and then come to Ignite in the afternoon? Is that the way that works, or?
That's correct. That's correct.
Do they have to be in school in the morning in order to come in the afternoon then?
Not 100%. That's not necessarily 100% true. We are trying to maintain engagement with them as much as we can, knowing that sometimes even if they're so that in general we're looking at positive attendance in the morning, engaging in their classes and passing their classes in the morning, but we are also working with a group of students who have been traditionally so disengaged for the last number of years that we are doing whatever we can to try and continue to keep them engaged and keep trying to work towards improving their attendance. So I would say that the attendance at school has been a little bit less than what we're seeing at Ignite, but we're working with the school district in partnership with them to kind of try and keep all those kids on track. So it's not 100% that if they're not in school that they can't come here in the afternoon, but we are working to continue to improve that on a regular basis.
Scott, I got a question for you. You said you had up to 70 and that was too many. What can we do to make that so it's not too many? I would like to see us be able to, at some point, if it's expanding that well, let's embrace it.
Well, right,
I don't need an answer here tonight. but
who was that was asking the question, just so I can?
This is Matt McKenzie.
Hi, Matt. Yeah, that's transportation is a challenge. Physical space is a challenge. You know, we're at over 8,000 square feet here in the ADC. 70 kids with the number of staff that we have. I mean, a big part of what we're doing here is it's about relationships with kids. It's not about having people running around with whistles like lifeguards. And so when we have that many kids, the level of chaos that can start to permeate through that is a little bit of it's a little bit less impactful, and it's a little bit less successful. And we also are scaring away some of the kids that when they come in and they have that many kids around. So I think, you know, I don't know really that I don't really see any way that our budget can expand. You know, right now with what we're running through the BFI grant at $375,000 a year, we just did this expansion grant with DPI and the school district where we're running stuff during the daytime. We have a youth justice innovations grant, which is almost $150,000 a year. So we're staffing. I still have mostly part-time staff. I don't have a lot of full-time staff. So the numbers of people, like the budgets, the space, what it costs us to rent this space, I don't know where that extra capacity would come from. But I'm certainly willing to entertain the conversation, Matt, but I don't see any quick, easy answers to where that additional capacity would come from.
I get it. I'm not looking for quick and easy. I'm looking for continued success, and if we can expand on it, that would be a goal I'd like to see us shoot for.
I think it might involve cloning Scott too.
Yeah. Any other questions?
Hey, Scott, Matt Horning, question.
Hey, Matt.
Hey, good to see you. How long is this Ignite grant, and what's been the feedback from the school so far? As far as, you know, just a couple months in.
Thus far, my primary contacts within the school district right now are Rob Prater and Pam Houston and Alyssa Prater. So Alyssa Prater is the alt ed director of the alt ed program at the high school. Rob Prater is the superintendent, and Pam Houston, who is the assistant principal. And right now, those as my primary contacts within the district, the feedback is really positive. Again, we know that with a 2-month-old program like this, there's always still room to grow and get better. But right now, I think that if you were to ask any of those 3 partners who are most intimately involved in the program, that they're very, very happy with what we're seeing. I get the chance to talk with Rob Prater pretty regularly, and just the attendance numbers alone are a complete 180 from what we've seen for a lot of these kids, and that in and of itself is a huge win. But you know, I think that we're always looking for ways that we can continue to have some of these kids who have been really disengaged. And I think that's the thing, when we've had some of these kids that as of COVID, when schools shut down on COVID, these kids checked out of school and have not checked back in again until this year. So to have them coming here 90% of the time, having these kids, I've got some kids with 100% attendance already this time of the year. That's unheard of with a lot of these kids in the last couple of years. Attendance numbers at the district have been really, really low for the last few years. And so that is our first small win is our attendance numbers, and that we've got kids that are engaging in projects and engaging in some pretty good learning. And that's what we're banking on right now. So.
And how long was it for, Scott?
Oh, so technically the money has to be encumbered by September of 2024. So we are in conversation with DPI to see, because we are contracting with the district. It is our understanding as of now that the county can encumber that money by invoicing the school district for that money by September of 2024. And we wrote into the original contract that we can pre-bill them for services to be delivered. And so I believe that what we're really hoping is to be able to stretch that money through the end of the 24-25 school year. We're looking at ways to, Rob Prater is on board with helping to try and figure out how do we find additional streams of funding to be able to do that. But right now, this is one-time money. It's ARPA money. It's ESSER 3 ARPA money. So it is a one-time grant. There is no continuation of that particular stream of funding. So right now, we're really hoping to be able to stretch through the end of the 24-25 school year. I haven't gotten into my the kind of the year-end budget analysis to figure out where we stand at the end of 23 yet. So, that's coming up here after Thanksgiving to really figure out like what did we use based on what we had projected for 23. But it's a one-time funding of it's a one-time pool of money right now.
Thank you.
Scott, how do those Ignite kids get there? Do they come on their own, or does this district?
No,
transfer?
So as many of you know, we contract with BART, and so our staff has become volunteer BART drivers, and so we pick up BART vehicles. We also have that one 4-H van but we pick up BART vehicles and then drive up to the high school, pick those kids up, and then bring them back down. And then at 3:15, we transport them back up to the high school for kids that need to catch buses or kids that have after school sports or after school clubs or anything like that. So, we're doing transportation both ways using BART vehicles.
Okay. Any other questions for Scott? All right, thanks, Scott.
All right, thank you, everyone.
Public health update and parks project report. Liz.
That's me. So I just wanted to give a quick update as far as influenza season, how we're going so far. Our numbers so far for the in-school setting that we offer the flu vaccines for, we do have one clinic left scheduled for the elementary school and Marengo Valley School to happen on Thursday. But the numbers that we're at right now are 198 kiddos have received a flu vaccine. As compared to last year where we had 378 children receive a flu vaccine in the mass clinic setting. The year prior was 322, 323 the year prior. So our numbers are significantly down for the in-school setting this year. And then also for our public health clinics, whether that be the drive-throughs, walk-in, private businesses, whatever it would be that way. So far this year, we've had 218 people receive a flu vaccination. As compared to last year for all of flu season, we had 324. So if anybody's looking for a flu vaccine, specifically high dose flu vaccine for those that are 65 plus, please send them our way. We do have a good supply of flu vaccine left, and we are able to bill some insurance providers. We clarify that with the person when they call as to what their insurance is for if we can bill them or not. So numbers are down. It sounds like throughout the state as far as flu vaccination rates though. So it's hopefully flu season is mild this year, just based on what the vaccination rates are. So, but otherwise, a more fun update is the parks project. So we officially have, and I have all sorts of pictures for you. Construction for the town of Gordon, so that's the Gordon Lake Park, is complete. And then the village of Butternut received all of their equipment at the very beginning of November, so as of November 3rd. And the construction crew was very quick in their turnaround time, and that park is complete. And my park assistant and I went and tested it out over the weekend. She gave it a 2 thumbs up with her stamp of approval. It's a very nice little.
That's the stamp of approval right there.
That one's
Yeah.
the one where she's at the top of the slide there. That's at the Golden Lake one, but I got another one of her coming down the slide in Butternut too. So very nice parks. They both are absolutely gorgeous. And I know there's been kids playing at both of them It's been fantastic, the response that we've had from them. And then we also had provided a donation of $25,000 towards the Marion Park project for the town of Jacobs in Glidden. So I believe they're roughly $10,000 shy of their ultimate goal right now to get their new park equipment for Marion Park. So that is, come a long way as far as the fundraising for that. And then we have one project that is left, and that is the Three Rivers Park in Mellon. So they have I believe it's a 10-bay swing set that has been delivered to them, so that's in storage right now. And then they have a very large play structure it's kind of like an obstacle course, activity course that has a climbing wall and some like monkey bars going across and stuff like that. That is set to be delivered on December 7th. So pending weather, we'll see if we can get it in yet this year. I know for the Butternut Park, there was some issues with getting the cement to set for the supports because it was so cold. So we may have to wait until spring to get the Three Rivers Park in Mellon fully constructed, but it's getting there. A couple more weeks and they should have all their equipment, so.
George,
Yeah, are there summer swimming facilities in any of these parks?
Gordon Lake has the lake.
I don't know, is there a beach? Is there a beach house?
Oh, yeah, they have,
a
they don't
program?
have the beach house at Gordon Lake anymore. It was probably a human health hazard at one point in time. So the beach house has actually been taken down, but then through a different line of funding, they actually built a new pavilion that has bathroom facilities down there. And historically, they have offered swimming lessons at Gordon Lake. They have a little area off of the beach that they cordon off. They've done swimming lessons there in the past. I don't know what they have as far as swimming lessons available now, but I know historically they have like 30 years ago.
And is the water quality monitored then for swimming?
I don't know if there's any monitoring in Gordon Lake.
Okay.
Is it okay if I interject about the swimming lessons?
Yes, please.
They do not offer swimming lessons at Gordon Lake Beach and haven't for, I mean, back when Liz and I were little, they would have. They haven't for quite some time. They generally will use the Park Falls pool due to lack, I think they've tried, but there's been a lack of people willing to teach the swimming lessons at Gordon Lake Beach.
It's
This is
cool.
Amber. I did hear too that Mellon school is trying to bring it back for next summer, so you might see it in Mellon next summer, because the teacher that used to do it is back at the school, so that might be an option for not having to go to Park Falls.
Matt,
And Mellon has and unless it's changed, they've had a relationship with the state park out there and they do their swimming out there and have for many years.
Which park?
At
Copper Falls.
Falls.
Copper Falls has Loon Lake.
Loon Lake, yeah.
Oh, yeah.
Yeah, that's just, they work with the school. So it was something that they couldn't find anyone to teach last year, but it sounds like they're getting it back in place for this next summer, so.
Any other questions or comments?
And ask Liz if she got, did you get hazard pay for trying out the equipment or?
No, but I will say we did get rather muddy this weekend because it rained up here, it snowed down there. And to test out the slides, I had to take one for the team and I drove home with a wet behind, so.
All right, we'll move on then. Opioid settlement stakeholder group, Matt Grant update.
Okay, I don't know, I don't think we discussed it because it came up very quickly, so we had the opportunity to help the sheriff's department with their initiative to do medication-assisted treatment in their jails for people who are addicted to medications, opioids, meth, different things like that, mostly opioids. We mostly Liz, wrote a grant for the jail to be able to apply for a significant amount of funding of $194,000, I believe it was. That would pay for medications, either a recovery coach or a certified peer specialist to go into the jail and work with the inmates one-on-one, watch the administration of the medication so that they're not diverted, do treatment groups in the jail, and then do a very warm handoff to our CCS program as they are exiting the jail if they so wish, which we would encourage. We are crossing our fingers. We won't find out until December if we get that funding, but that is an initiative that public property and law enforcement wanted to see happen with some of the opioid settlement funds. So we're hoping that, and that's a bigger amount than our opioid settlement funds would cover. So at least for a good startup and get the program going, that would be good. Again, we probably won't hear until December. And I know last time we had talked about we have a committee called the Overdose Fatality Review Team, and our findings by reviewing the fatal overdoses have really shown us that we really need to have some kind of transitional housing. So what we would propose is a 1 to 2 bedroom adult family home that could really do a kind of a wraparound approach with some of the systems that we already have to help people as they're coming out of treatment and not just sending them back into the same environment where they had used before with family and friends who may support the use, really give them some skills. So one of the things that I know has been talked about is having a stakeholder group to talk about these different options and then come together and discuss and find out what the community wants to use those funds for. So the recommendation that we have is we already have this opioid fatality review team. And I'll let Liz talk, this is Liz's team, so I'll let her talk about it a little bit more about what it's comprised of, what it does, and how we see that kind of working in with this, the settlement funds.
So the OFR, and I don't know if anybody's familiar with the basis of a death review team. Ashland County does have a child death review team, and we built the overdose fatality review team as a similar structure as what the child death review team is. So the goal of the team is to review a individual circumstance where a person has passed from an overdose, whether it be accidental, intentional, whatever the cause would be. But all of the stakeholders come together with the information that they have about that individual. So, public health, if we have information, we have children's unit will provide information if there's anything available, adult protective services, CCS, we have law enforcement, Department of Justice, drug court. We have peer support. We have several different individuals from the Bad River Clinic or Bad River Fire or treatment. What am I missing? I feel like there's more. Depending on the availability, the DA will join. Inpatient behavioral health services, outpatient behavioral health services. We have a group of people from as many different places that we can get pulled together, and everybody shares the information that we have available. And it's a very open, very frank conversation of this is what we know, this is what happened. Where did this person fall through the gaps? What can we do to prevent a similar circumstance happening for another person within our community? And then we try to put recommendations forth from that. If we have similar recommendations, if we're noticing patterns or trends, and then that group can put those recommendations out or reach out to, providers, organizations, wherever it may be. From the local level, all the way up to the state level, we can actually put recommendations towards the state to see if there might be anything that could, come down as the state level. So, very kind of person-centered wraparound approach that we try to take to the evaluation of it. But with the number of people that we have, with the number of perspectives, it would also be a very well-rounded group to take on this task as well.
So I know it has been recommended that we have a stakeholder group, so I think this would be the perfect group. It's already in existence. It meets monthly. Every other month we meet to do,
Case review, and then the next month recommendations
Yeah.
review.
so on the months that we do the recommendations, that would be a time that we could meet as stakeholders and determine, you know, what are the needs out there? What can we use this opioid settlement funding for that will best serve our community? So we would request that this OFR team be appointed as the stakeholder group and make that recommendation to the full board.
Anyone care to make that motion?
I'll make that motion.
Rich? Is there a second?
I'll second it.
The motion has been made and seconded to request the OFR team to be appointed as the stakeholder group to discuss and determine best use for the county opioid settlement funds. Any comments or questions? Matt?
I guess, where will this money be held, in whose budget? And I guess, what are the requirements, if any, that come with it? I'm not saying that this maybe isn't a good group to have some discussion with it, but I guess
Well, they
I'm
wouldn't
also,
have the final say. They would make the recommendation to the full board.
all right,
The money currently is being held at not our agency, it's at the full county.
do you know, is it in Dan's on here, is it in a non-lapsing account? I'm assuming it is.
Yeah, it's in a non-lapsing account in the general fund.
Okay.
And a couple
So-
months ago, we had included in our packet all of the allowable uses for the opioid settlement fund. So if you need that again, I can send that out as well.
Yeah, I don't have that anymore. If you would send me a copy of that, I can see it.
Yep.
Any other questions or comments? We have a motion and a second. All in favor, signify by saying aye.
Aye.
Any opposed? Motion
Can you
carries.
guys hear me?
Yes.
I was trying to get a question in there and I had to
Oh.
restart Zoom once. I'm just, who all is on that committee that you guys just were talking about?
We have law enforcement, so the sheriff's department, the city of Ashland, if it's down in the lower part of the county, any law enforcement that was involved. We have the hospitals, the clinics, sometimes the district attorney's office, the sheriff's department.
Probation, drug court, EMS.
There's a lot.
Yeah.
You
the
have
list
full
of-
gamut of.
Yeah, the coroner, the deputy coroner, I'm trying to think of who's all in the room.
Several
Adults,
departments from Health and Human Services.
Yeah,
Yeah, pretty much everybody who has had experience with the opioid epidemic.
Which is good.
It would be nice to have that list sent out to, of the actual people on the committee. I still would like to see I understand each county is supposed to have a group like this, but I would like to see a regional cooperation with the money that we get, because we're only gonna get so much. And
I
to
don't-
make the biggest bang for the buck, we can cooperate on some of these projects too.
And not all counties have this. This is an application process that you have to go through with the state to be able to have this funded opioid fatality review team. So I don't believe the county has one yet.
Fayetteville County does not have an OFR. No, we're actually the only county in our region. Well, obviously we're the northernmost, but one of the only ones in the northern region that has an OFR. It kind of cuts off at Marathon County.
Oh. We're on the leading edge, cool.
Because we already voted on, I'm sure it's ordered, but just wondering, who's the coordinator, who's the facilitator of the group?
Liz.
Okay, thank you.
So Laura,
Buck stops here.
to just kind of expand on your question a little bit, I think this would be a team that would look at what Ashland County needs, and then based on what those needs are, we can always reach out to other counties and include them in to see if they would want to join forces with us, if they agree. They, I know Bayfield County is doing a community needs study for their opioid settlement funds, and I'm sure we're all gonna have very similar findings, I think, because we all have the same kind of problems. They're very similar,
Yeah, I know we're only get so much of a crack out of this, and the state decided to take a big chunk of the money too, and so, when it comes down to it, it may be, of course, left to our regions / counties to cooperate and make the most difference, so thank you very much.
Sure. And can I just ask who joined by phone 209-0288? Just for our attendance.
Well, it's a public meeting, it could be anybody, right?
Yeah.
Okay.
Okay, we'll move on. Staffing updates.
So there have been quite a few, and I won't go into too much detail. We have had some turnover. We've had some people move away. We currently have hired a new social manager for the children's unit. We also have replaced the prior family services position. So that's somebody who goes into the home and helps with parenting skills and observes visits for safety and educational purposes. We replaced Jean Tyndall, who had retired from the public health department. So we have a new nurse in that unit. Most of you probably are aware that the adult drug court got renewed for yet another period of time for their grant. So they are hiring a coordinator for that position, and good candidates there. We're hiring for a service facilitator to replace somebody who moved to the cities. And we are hiring for a dementia care specialist because that person left us to get married and moved away. I think that's, and one of our workers went back to school, so we're replacing that for the Children's Long-Term Support Program. And we also have a retirement up and coming. So Val Levino, who is our supervisor for the CCS program, has given 5 years of service to us, and she will be retiring in May. So we're going to start recruiting. That's a huge position. She's the administrator of that program for both Ashland and Bayfield counties. So we'll be recruiting for that position as well.
Here, can I ask that the adult drug court, is that for 1 year, or how long did we? Successful at?
It's at least 3 and it may be
Good.
5. I don't recall, but it's a good chunk of time.
Good.
Yeah. So we're
Oh,
very
it's,
happy
it's a 4-year grant.
for you.
Oh.
Right in between.
3, 5.
Yeah.
At least 3 and maybe 5.
Yeah.
Split the difference.
Yeah, so that's good news.
Good. Any questions about the staffing? On-call employment wages.
So this was requested to be put back on the agenda for this meeting. We had talked about it, it was in the materials last time, and we talked about it briefly. So per the request of this committee, we brought it back just for discussion. I know somebody had done the math for our unit last time to increase the pay, which hasn't been increased in over 20 years. And for our unit, it would be about $8,500, I think is what it came to. But there's a bigger picture because there are other departments within the county who do have some on-call. So we don't want to, I think it needs to be a county-wide, take a look at, what we can do, what we can afford, but what the process should be. So I guess, the recommendation from our department would be to, kind of put a work group together for the different departments who do have on-call and kind of come up with what might be a good recommendation for all of the departments countywide. And then just kind of form a committee to talk about that, but this would have to go to the executive. So our recommendation would be to form a committee and have that presented to the executive committee to take a look at the on-call pay.
So you, talking about a county-wide committee to look at this?
I mean, we could make a recommendation for our unit, but there's other units, so I think we have to be fair and look at the overall picture.
I would guess about how many committees are involved.
Well, I really think it's just us in the highway department, but I'm not sure.
Oh,
Cause there's many little small departments that I don't know if anybody has on call.
George, should this go to the executive committee?
Yeah, I think that's
Yeah.
what we'd be making a
So we
recommendation.
just
form
make a
committee.
recommendation that the executive committee form a committee to look at this?
Yeah,
I would so move.
Second.
Okay, motion has been made and seconded to recommend to the county executive committee that they form a committee to look at payments that are made to those departments that have on-call workers. Compensation for being on call. Any other discussion? Matt?
do we really need to ask them to form a committee or just ask that they look at this and come up with
Yeah,
a
that might be,
possible
yeah.
solution? It is within their role.
Mhm.
sure.
It would be nice if they would include the fiscal consultants in on that too.
Laura, we can have Mike and Steve involved in that.
Will
I
be,
think the aspect about the committee is that we suggest that they may want to form a committee.
Okay. Is that your motion then?
Yeah.
Is there any other discussion or questions? Otherwise, all in favor of the motion signify by saying aye.
Aye.
Opposed? Motion carries. Approved debt cap licensing fees.
Alright, so the background for this is DATCAP has recently updated a couple of the statutes, specifically ATCP 78.08 and 76.06. So essentially what this did is it expanded on the classification of recreational educational camp license categories and also the classification of pool license categories. So previously, we just had rec ed camps were essentially just rec ed camps. There was one classification for them. There wasn't any differentiation depending on the complexity and what services they all provide. The same as for operation of pools or public swimming. So it was, if you have a pool or a hot tub, like a hotel motel, it was, very cut and dry. You have a pool, you have a hot tub, this is your license. You have a water attraction like a water slide, this is your license. But there's a lot of complexity that goes into it as far as the size of the pool and the different chlorination and ventilation and everything depending on the size. So what they did is they actually reclassified things as far as simple versus complex, moderate with hospitality, without hospitality, depending on the complexity of the business and all of the services that they provide. So we need a new fee schedule to go along with this because our current fee schedule is just as it's listed for rec ed camps, our current fee schedule is just one fee across the board for any rec ed camps, regardless of where the size of them or the complexity would fall into. And then the new fee schedule breaks it out into simple with hospitality, moderate with hospitality, and so forth. And the same as with the pools. Previous classification was just with a pool or a hot tub. If they have a water attraction and then water attraction with the additional slides, they have a whole new structure of simple with features, moderate with features, complex with features, and that's all described specifically in the code. So we would ask that we would be able to move forth with adopting the new fee structure to include the DAT cap classifications for rec ed camps and pool licenses.
How many of these do we have in the county? Any idea?
Rec ed camps, I believe we have 3 in total, and then the hotel motels, it would be. I wanna say there's like 8 of them, because it includes the ones that have, like if they just have like a little hot tub and stuff like that too, so. There aren't a ton of them, but we need a classification for them.
Do we need to do any public hearing before we change these fees?
I know last time when we increased the entire fee structure, we did, so I would. Leave that to your discretion.
Matt?
All right, I'll make a motion.
You have a, yeah, I mean, we don't have no. This is set anyway by the state, right? We don't, it goes through no matter what, wouldn't it? Or we just have to accept it?
We would, because it's a change in the fee
We just have to
structure,
accept it.
we would have to approve the fee structure.
Okay.
Go ahead, Matt.
I'll make a motion that we schedule this for a public hearing at our next meeting. And if that's successful, after that, we'll move it on to the full board for final approval.
Any other questions or comments about that?
At our next meeting?
I didn't hear you, sorry.
At our next meeting?
At
At
our-
ours, we could do, I believe we could just, Liz knows who we have. As far as permits, we can send them notice that we're looking at and have a public hearing here. To give them a chance to say why or why not.
Okay.
Yeah, and then if we pass it, then we can now make note of the fact that we did have a public hearing and.
You're increasing some of the fees.
Yeah.
Okay.
Any other questions? Otherwise, all in favor, signify by saying aye.
I,
Opposed? Motion carries. Substance use funding, prevention funding. And pro-social prevention activities.
Just wanted to give a quick update that, so each year we receive, or generally speaking, each year we receive substance abuse block grant funding, and then we have also received supplemental substance abuse block grant funding the last couple of years with some ARPA funds. So last year, or I guess we have to spend a certain percentage, I believe it's 20% of those funds on primary prevention. So last year, we were trying to get creative and come up with ways. So we reached out to all of the school districts within the county and offered up to them, like, say you have a field trip or a fundraiser that really encourages, like, healthy social skills, but also maybe they're learning a new skill or just a way to occupy their time, just a positive activity that they could submit for some funding reimbursement or some funding towards that event, depending if it had already happened or not. So we do plan to do that again this year. Another way we plan to use some of that is, I was contacted by the individual from the Breeding Center who is working on a lot of their drop-in activities. and they have seen increases in requests from families who can't afford to pay for the activity, or, maybe the kid's been coming and now, finances aren't great, so they can't afford to continue to pay for that. They were talking about it at a different meeting I was at, so I connected with her and we were able to, or we're in the process, I should say, but we're going to give some of that funding over to them so that those kids, maybe they're in gymnastics and have been in gymnastics for 2 years now, but now their family can't afford for them to continue. Or the Breading Center is really also working on new activities, especially for some of our younger kids, elementary age kids. So to make sure that anybody who wants to take part in those has the opportunity, and that due to their family's financial situation, it's not a limiting factor for them to be able to try it. So we're pretty excited about that, just another opportunity. And we will be connecting with the schools probably early next week to get that out. And then we'll be in communication with them about what they have planned and what they would maybe like to do, but they can't fund it. So it's just one of the ways we've tried to get creative and spend some of our primary prevention funding that we have.
Any questions for Tasha?
How much money do you have every year, Tasha?
So it really kind of fluctuates. Like I said, the last couple years, we've received some supplemental funding. And then our substance abuse block grant funding isn't always the same. It's usually, and Terry, correct me if I'm wrong, I think it's usually right around like $20,000-ish.
Right around 28,000.
So we have a minimum of 20% of that has to be spent on primary prevention. And the allowable expenses for that grant in general are pretty specific. So sometimes it's a bit of a struggle, even though we know we have a huge need for substance abuse treatment. The stipulations that go along with that are pretty strict. So.
And we can't use that to pay room and board, which Medicaid doesn't cover. So that's before Medicaid paid for residential treatment, we could pay for the whole thing. And when Medicaid started paying for it, they said, well, you have to carve out the room and board. Well, that people who are on Medicaid have limited assets and income, and they can't afford to pay $50 to $75 a day for room and board. So it's kind of hampered what we can do with that funding and how many people we can help. So we've used it in more creative ways recently.
Matt?
I'd suggest that we target some summer programs too. I know that the city, and I'm sure Mellon and others have similar programs, like Art in the Park, where they're always looking for funding to help pay for supplies and order the instruction. And I think this would be an excellent opportunity to help out those groups. At the same time, they're gonna give them an alternative to sitting around and doing nothing and getting into further trouble.
Absolutely. We will definitely do that.
Yeah.
Anything else for Tasha? All right, then we'll move on to child care certification process.
And we'll have Amy talk about this, but the reason we added it on here, and it was a last minute thing, was, as most of you are aware, our largest childcare facility is closing. So Evergrow has given their notice, which is going to be a huge loss for our community. So Amy's just going to touch on some of, did we lose Amy?
She's there.
No, I'm here.
Oh.
Right.
Just Amy.
Just really quiet. So now I'll stop being quiet. So yes, with Evergrow closing, obviously that's going to make a pretty big impact in our community for people who either live in Ashland or work in Ashland. So one of the things we want to do is we just want to remind members of the community that we do have a child care certification program. So we are currently in the process of having some outreach with the school districts. I want to try to reach families with children. So reach those parents and let them know that we do have that certification process, either through their virtual boards or their newsletters. And we've already been, Laura Harnish is our childcare certifier. She's already submitted advertisements via our Ashland County Facebook accounts. So those advertisements are already out there. And then we're also going to be reaching out to our local papers. In addition to the childcare certification process, we're also going to do that same thing with our wheat program. That way we can reach some of our vulnerable and families and community members. We'll also be doing that through that same blurb process with the school districts as well as the local newspapers. And then we want to basically let folks know that we do also with the wheat program have a water conservation program as well. So.
Good morning.
Amy, can you give us the why and the when for Evergrow? I saw this just in this packet right before this meeting and I was just horrified.
Well, it's in the local paper. So I guess I can't really, I wouldn't speak for Evergrow, but they are planning on closing. I'm not exactly sure when their closing date is, but it is happening. They do have an article that's looks like it's publicly available in the Daily Press to review. But as far as their exact whys, I couldn't speak on that for them.
And Joy put in the chat, it is December 1st.
Okay.
Thank you.
George,
Do we know who owns the facility?
The building that they're in is a lease and Gary Lapine owns the building.
yeah,
Yeah, it's Gary Lapine. He owns the building.
Is there anything for us to do as a Health and Human Services Board, Amy, other than this licensing thing? Because I know that took a great effort to get that together and there were a lot of stakeholders and everybody pulling together because there's this desperate need for childcare. And yeah, I mean, it's just like heartbreaking. Again, I haven't read the online newspaper today. I'm pretty up on the Daily Press, so I just missed it today, but or maybe it's been on the line for a couple days and I only read the print, but yeah, I don't know what we can do, but it feels like there's something, I don't know, is there a role for Health and Human Services Board to do anything more or?
I could maybe mention, I used to be on the board of directors for Evergrow. One of the people that helped put it together. But the biggest issue right now is staff. We can't have a daycare if we don't have consistent staff. And that's really, there's free training, there's free this, there's free that. We just don't have bodies. And if you don't have bodies, you can't have children. So it's an issue affecting everybody. But in childcare, it's extremely difficult when you have people that, okay, there's a teacher today, they can drop off their kids, they can go to work. There's not a teacher tomorrow, they can't go to work. It's extremely difficult.
yeah, that was my understanding, that it was difficulty in retaining staff is a big part of it. Any other questions? All right, we'll move on to the written materials. The supervisors wish to make us aware of anything in the written materials we should. Or anybody have any questions about the written materials, Rich?
I don't want to see here where they hiked the age up for 23 for adult. I mean, it was a child and what is it, but they increased the age to 23.
I think that's just it's for the children who were in out of home care during the pandemic. Just to make sure there was continuity of care for them so that they could receive services past the age of 21. So it's short, it's a short term.
Short term. Oh, okay.
Any other questions? Something in the chat there?
I think that was the December first.
Otherwise, we'll move on to board member updates and possible agenda items for the future. George?
I just have a question. I wonder how we're doing on our facilities for space requirements area.
So that's not with our unit. I think that's through law enforcement, public property and law enforcement.
But I'm talking about the adequacy of the facilities that you have available for your staff.
We are squeezed in like sardines.
But you all fit in the camp, right?
We do, and we play nice in the sandbox. We do have a worker in the economic support unit who's been here a year, and he's ready to go remote, which will help us a little bit. But yeah, when we have interns, they're doubled up in a supervisor's office, makeshift desk, just, it's not a great setup. We have no room for storage, at all.
Did you have a proposal for a storage?
Well, we were considering
Building.
that until last winter when we had Snowmageddon. And there was no.
It would have been destroyed. Yeah.
And we just went, wow, there is just really not room for a storage building. There may be a spot over by the dumpsters. We're gonna kind of assess it a little more this year when they do the snow removal to see. But, we're lined up with apple trees here, and I think they actually kind of bent a few of those. They did a little damage to our, handicap ramp on the public health side, just because they were trying to get the snow, and our parking lot just got smaller and smaller.
Snow then, yeah.
So hopefully we won't have another year like that, but yeah, we had talked about a storage building. We had talked about a tiny house for flu clinics, vaccination clinics, some storage for public health. And we realized quickly that tiny house situation would not work out for us. So we got playground equipment instead.
Any other questions or comments?
I got one.
Rich?
I guess I'll throw it out here. I don't know. Well, lately, I have a few people that come up to me and they're talking about, the nurses threatening them to get arrested or throwing them in jail. I mean, did something happen recently about with some kind of people or something, or?
No, there was a news article based on the ordinance that we
Yeah.
put through.
Oh,
That was
okay.
taken out of context, number
Oh, okay,
one.
cause yeah, people been coming up to me, boy, I don't know.
They did put a little, what would you call it? Wasn't a retraction, it was just a little.
There was an editor's note.
Corrected it or something to
But,
that effect.
Yeah, so if I can,
Yes.
Go ahead.
the
Probably
communi-
don't help to vent.
well, we're being recorded, so. When the communicable disease ordinance was published, the newspaper was present at the board meetings when it was discussed and it was, motioned or put through and then published. And then afterwards, we received inquiries and interest from the daily press regarding the communicable disease ordinance as to where it came from, the intent, kind of the backstory on it. So I did provide them with the information, and then, he had requested to come down to our flu clinic to take pictures, which, it's open to the public. You're welcome to drive through. And then some of the questions that they were asking, I did, because he came down here on 2 or 3 separate times, he came back to the clinic, and I did ask him, I pulled him aside and let him know that I was concerned as to the tone that he would be writing the article based on the questions that he was asking, because this can be it's a bit of a hot button issue right now. I may be biased, but I feel that he sidestepped my question and did not answer me as to what his intent for the tone of the article was. So I was very concerned that it would be misleading when it was published. The day that it was published, the original article, I did call and I spoke with the editor and I questioned. Yeah, I expressed concern regarding the missing context and the missing information that, this information was provided to you and. That is missing from the article. It's misleading, it's misrepresenting, and you are bestowing powers upon the position of the health officer that are not the position of the health officer. So they did make a small editor's note to the online version of the article. But to the best of my knowledge, they did not correct anything in print that I have seen. So that was obviously misleading for people that only received the print copy and not the online version.
Oh, okay.
They did welcome me to write a editorial response to the article. However, in talking with the state media team, that may add more fuel to the fire as far as a negative response to it by responding directly. So we were cautioned against proceeding with that.
Okay, thanks, I got it cleared up.
Rich, I think the comments you're receiving probably triggered by the letter to the editor following the story that was in the paper. I forget the name of the person from High Bridge area.
Okay.
Who had personal rights issue, which we discussed in depth when we prepared the ordinance, right? Make sure everybody had due process rights. But I think when people saw that letter to the editor, they probably got comments.
Okay, yeah, probably that's what it was. So, okay, thanks for clearing up.
Yeah. I guess I have a concern I think we should look at, but I don't know that there's anything we can do about it. And I hate to address it that way, but it's basically what's being referred to as our homelessness issue around here. And it's really more of a vagrancy than homeless, in that they could probably find a place. They just choose not to. And that population seems to be growing. And it does create some health concerns, and not to mention concerns of the public. And to me, I suspect that some of this is mental health related or addiction issues. And I don't know, the old saying, you can't help somebody that doesn't want help. But is there some way we could lead the horse to water where they would want help? I don't know. But it's and every place has it. You can't say it's just Ashland, wherever. Bigger cities have, complete villages now. But it's something, if there's something we could look at or somehow address, I think it would be worth looking at. And I guess I just want to set it out there on the table. I'm not sure there is anything we can do about it, but it is definitely a public health issue.
I think that there are a lot more factors than just the mental health and just the substance use. There are a shortage of rentable, affordable homes in Ashland. If you look at your basic apartments in Ashland nowadays are going for $9,000, $1,200 a month. And that may not even include your utilities. So I think there's more.
Yeah, Jerry, I think we've got that population kind of served, to be honest, with the emergency shelter and then the transitional. And what we're talking about is people that just don't want to, have an apartment, if you will. They're more happy just squatting. Honestly, those two houses that you just saw taken down over off of 7th Ave East were taken down because we couldn't keep people out of them. And, they're going in there, it's mostly drug related activity too. And you just get them out of one place, it's another place. The water treatment plant, the old water treatment plant, same thing.
Yeah.
And, the police department is frustrated. What do you do with it?
Yeah. So
there's hardly an empty building around this community that we don't have problems with as far as people getting in there.
Yeah.
And it's the apartments, there are apartments available. The cost of them is always another issue. I mean, and it's phenomenal what they're getting for apartments in some places. I get it. But I think we do have a lot of that covered. with the emergency shelter and hopefully with the new transitional housing whenever it gets in there.
So do you want to put homelessness on the county, like our like health and human services agenda? Cause I mean, it's a great topic, but I think, yeah, there's all these sides to it and
Right.
it's, and even within the county. I think most of us have a window only in city of Ashland, and yet I suspect there's an element of homelessness or housing insecurity throughout the county, you know, and so it's certainly, yeah, I mean, I'd love to dig into that if we want, but it's, yeah, I mean, it's, yeah, certainly a question of what's our goal, but yeah, just to like, yeah, that's a lot of staff time to try to pull numbers and, you know, again, yeah, it's all that stuff tied together. So-
One thing I would say, just to be mindful of regarding the housing situation and, you know, affordable, good, clean apartments for rent are definitely a huge part of it because, you know, if a person's trying to pay $1,000 a month for rent, you have multiple families living in one small apartment, paying to make the $1,000 a month per rent. But then the other side of that then is with the housing market, when homes are coming up for sale, you know, there are a good number of them that are being brought up by individuals that are not in the area, and then those properties are being flipped. And you know, the Airbnb, the tourist rooming houses, the short-term rentals, there's more and more new ones every year. And when those properties are going to the Airbnbs, the short-term rentals and things like that, that takes away then from the individuals that would be able to rent out that property and actually live in the area and be there. And I know we see some of it. I know some areas have a much more significant problem as far as the number of Airbnbs and rentals using up the available housing market, but there is a factor coming in that as well. You know, and I know that takes away as far as tourism and people coming to visit the area when there's not as many rentals available, but you know, cause and effect, risk versus benefits, it is also something to consider at potentially at some point in time for capping the number of licenses that would be available in an area for short-term rentals.
I can tell you the perception is that Airbnbs are taking more homes off the market than, but that's not exactly true either. There's a greater problem with families that have, you know, their parents or whatever pass, and then the house sits empty. It doesn't get used. We're probably losing more housing that way than we are actually from Airbnbs. You know, the numbers, I guess I don't want to get into too much, but the numbers are not what concerns me as much as what can we do to help some of these people that don't want to comply. And I mean, you can't, it does no good to throw them in jail. It would just cost us more money. And the real issue is why do they not want to conform? And many times it is some issue, you know, short of whatever.
There's good data that most folks want housing, and if given it, they'll take it. So, you know what I mean? Again, there's like, yeah, big cities have done this, and yeah, they can't build housing quick enough to house people, but yeah, you know what I mean? Most of those people that don't want housing, yeah, they have other issues that they're working through, but yeah, they would love it, man, if you would, you know, City of Ashland opens up a 300 bed, you know, or 300 apartment, low income, affordable housing unit.
Laura?
And I'm in my senior population, I'm finding that some of them are at the homeless shelter trying to find homes and are having a hard time with it. So there are people that want some homes, but again, it's either people trying to call them back, there's no housing available. So if they don't have a place to go and get out of there, then it can create another space for someone who may be transient. And there are quite a few of those. We've had those too. But if we have people that are at the homeless shelter that are looking for homes and can't find them, then they're taking space for people who might not squat, but use those spaces. So we are still at that housing lack. And I have people that are fighting really hard to try to get into a home and are having so many problems and so many hurdles. So I just caution on that. I know we've talked about it earlier in this meeting about drug issues and things like that. Yeah, there's that factor too. But we're not scooting enough people through the system into homes in order to say that we don't, but that we have this transient problem or this squatting problem because that homeless shelter is full all the time.
Yes.
Well, the other part of the problem is not only is the cost of rent gone sky high, but look at what houses are selling for now, and a lot of people can't afford to buy a house.
Yeah, just over on Beezer, there was a house that went for about 30 grand and they turned around, put some flooring in it and slapped some stuff on the outside and it's selling for $100,000.
Yeah.
It just priced it out of most of our people's range. So it's great if it sells and we get taxed for it, but if it doesn't provide a home for the people that need the homes the most, it's not good. It's partially a zoning issue.
Mhm.
Yeah, New Day, I mean, struggles with this too, where they're full all the time also and can't get new clients in because clients who want to rent a place and have money to rent a place can't find a place to rent. So it's, yeah, I mean, they're just, you know what I mean? There's a lot of, evidence that our community doesn't have the housing that we need.
And for the individuals that do opt to camp by their choice, there is no, I mean, that's if they're their own person, their own responsible party, and that is how they choose to live. It may not be something that I agree with. It may not be something that any of you agree with, but camping and as your means of sustaining yourself is not a human health hazard violation. They are 100% within their right to do that. If it's in a space that is permissible to do so.
To camp with them.
Rich.
Oh, I was just saying that. Somebody
ahead,
wants to. Well, I was just gonna say that, well, it's all over Melon too, but I mean. A lot of people, they can't get a job because of no housing. They apply for a job and then when it comes to get a house so they can work there, they have to say, well, no, I can't work here now. I can't find a place to live. So there's a lot of that in Mellon, I'm sure in Ashland, I'm sure all over.
We have that happen right here.
Yeah, so it's all over like that. You
School
can't get
district
people to
has
work.
run into that problem,
Yeah,
hiring teachers and they can't find a place to live.
Yeah.
Medical community, same thing.
it's
I
bad.
still think it would be a good idea. We've got 20 acres of land out on Farm Road. That would be a great housing development, and I think as a piece of our Health and Human Services, it is a good way to encourage the county board to think about dropping some buildings on there. There could be quite the 3 different 4-story buildings out there. And we keep saying we don't have contractors that'll come in. That would be a nice high density housing spot. The bus, PAC could run a bus route through it. My aging bus could make it through there because it's within the limits. So we could serve people and still, and make good use of that.
Matt.
Yeah, I just want to be clear that I'm not saying that there aren't housing shortages. I think, it's very clear there is. What I'm trying to get at though, and I'll just call them street people, are not the ones that are missing a house and need a house. They're not causing problems, honestly. They're finding some place. It's unfortunate, but they're finding some place and, there's not a problem. I'm talking about the street people that just flat out do not want to find an apartment. They'd take an apartment if you give them one, but they have no interest in paying for it and doing anything other than squatting, to be honest. And that's how you deal with it.
Sounds like an agenda item.
It does, because it impacts too with people that we talk about putting through treatment. Because when they get out, where do they go? At this point, they have to go back to the same people that have been helping them with the bad habits.
Unless we get that adult family 1 and 2 bed home.
Yeah. Right?
Yeah.
Right.
Yeah, we can put it on the future agenda and talk about it some more. Any other update or agenda items you'd like to see in the future? Any other business that we need to bring up? Otherwise, our next meeting is February 21st.
Move to adjourn.
Second.
Motion made and seconded to adjourn. All in favor?
Uh,
I,
Opposed? Motion carried.
Thank you.
Thanks, everyone.
thank you guys.